Okay, so tonight I'm going to be talking about Alzheimer's disease. So have you guys ever noticed someone in your family or a friend experiencing some mild confusion or difficulty remembering? Older people tend to forget their names or misplace things from time to time. And you may think that this kind of forgetfulness is normal. But if they are forgetting how to get home and asking the same questions over and over, and forgetting something that they know really well may be a sign of a serious problem. They may have Alzheimer's disease. This disease starts off slowly, and many people do not realize that they have it. They will blame old age for their forgetfulness, but their memory problems get more serious over time. Alzheimer's can happen to anyone. It can happen to you, a family member, or even a close friend. First off, I'm going to explain what Alzheimer's disease is. So what is Alzheimer's disease? On the website www.nai.nih.gov, it says that Alzheimer's disease is an irreversible progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. The total brain size shrinks with Alzheimer's disease. The tissue has progressively fewer nerve cells and connections. Plaques are found between the dying cells in the brain from the buildup of a protein called beta amyloid. There are different stages of Alzheimer's disease, and each stage has a different effects towards the person. In the early stages, a person may function independently. He or she may still drive, work, and be part of social activities. Despite this, the person may feel as if he or she is having memory lapse, such as forgetting familiar words or location of an everyday object. In moderate Alzheimer's is typically the longest stage and can last for many years. You may notice the person with Alzheimer's confusing their words, getting frustrated, angry, or acting in unexpected ways, such as refusing to bathe. Damage to nerve cells in the brain can make it difficult to express thoughts and perform routine tasks. In the final stage of Alzheimer's disease, an individual can lose their ability to respond to their environment, to carry on a conversation, and eventually to control movement. They may still say words or phrases, but communicating pain becomes difficult. As memory and cognitive skills continue to worsen, personality changes may take place, and individuals need extensive help with daily activities. What are the different signs and symptoms of Alzheimer's disease? On the website www.medicalnewstoday.com, it explains the different signs and symptoms. At first, increasing forgetfulness or mild confusion may be the only symptoms of Alzheimer's disease that you notice, but over time, the disease robs you of more of your memory, especially recent memories. The rate at which symptoms worsen varies from person to person. People with Alzheimer's disease may have multiple symptoms. They may repeat statements and questions over and over, not realizing that they have already asked a question. Alzheimer's disease causes difficulty concentrating and thinking, especially about abstract concepts like numbers. How is Alzheimer's disease treated? Current drugs may help mask the symptoms of Alzheimer's disease, but there is no treatment. A breakthrough Alzheimer's drug would treat the underlying disease and stop or delay the cell damage and eventually leads to worsening symptoms. Tonight I have shared with you some of the information that I have learned about Alzheimer's disease. The rate at which symptoms worsen varies from person to person and then can affect their lifestyle. Although there are no medications to cure this disease, medications can help delay the progression. I hope this information I shared with you tonight helps you understand what Alzheimer's disease is and how it can affect you or the people you know.